Hello everyone, it's Dr. Dave. Hopefully you're all doing well. You enjoyed the start of your week. You're looking forward to your day today. Hope you make it a healthy and happy one. Coming at you on behalf of the Toronto Neck and Back Pain Clinic with your daily health update for Tuesday, July 20th, 2021. Looking at 6 areas of health and wellness today. Somewhere around this video, you can read through all 6 areas if you would like a copy. If you have any questions, or you'd like to get a hold of us otherwise, you can DM us on social, give us a call here at the clinic, send us an email, and we'd be happy to help you out. Not going to treat, diagnose, prevent, or cure any illness or disease with our time together today. However, we might just stimulate some thoughts about your own health and wellness, or maybe the health and wellness of those around you today, to help keep making those good decisions to support that health and wellness journey, so that life you're living through that wonderful body and mind of yours stays healthy and fresh to create those great experiences you're looking to live. And that's what life is all about. So get out there and do that today. You can read through a report from the European Journal of Cancer Prevention, a connection between type 2 diabetes and a type of cancer called Cardia, gastric cancer. There's a correlation there for an increased risk. The Journal of the American Medical Association Psychiatry, June 2021, came out with a new study that supports there are brain changes noted among teens who use marijuana. So we want to be careful with that use, of course. Research shows some benefits, perhaps, and the legalization through North America, but maybe still some concerns. Something every person who may decide to use has to know. A good thing to, of course, talk about with your healthcare provider as well, because some people will respond or react differently as they would to many other substances as well. So the Journal of the American Heart Association gives us a good reminder in June 2021 about diet characteristics that are associated with sudden cardiac death. An analysis of data concerning over 21,000 adults found that individuals with a diet that frequently features fried foods, high amounts of fat, and sugary drinks is associated with up to a 46% increased risk for sudden cardiac death. So no symptoms, feeling good, apparently everything is well until it's not. And the nutrition can be a big component of that kind of unfortunate event. So watch out for those fried foods, the types of fats and how much fat you're eating every day, and those sugary, calorie-laden, nutrient-poor drinks, which really occasionally probably nice to enjoy, but we want to watch how much. Those we shouldn't even have in moderation. Maybe as a rare treat, North America could do without, maybe. American Council on Exercise also has a good recommendation, June 2021, on stretching. They note the following benefits of stretching: decreased stiffness and post-exercise aches and pains, increased range of motion, improved posture, functional performance and circulation, and reduced risk of injury, muscle tension, stress, and low back pain. So getting your body moving and maybe reminding it that it can do more than what you're using it for every day is a very good idea. Stretching certainly has its merits. But sometimes, especially the North American model of no pain, no gain, or more is better, we try to stretch so hard that maybe we don't actually get the benefit. So be cautious. Stretching doesn't have to be exhausting, doesn't have to be painful, don't have to force or try to become more flexible per se, but stretching is just good for the body to remind it that it can go further than maybe what you're using it for every day. The Mayo Clinic, June 2021, now that we're in the midst and throes of a wonderful summer, reminds us to watch out and know the signs for heat stroke. The Mayo Clinic lists the following heat stroke related symptoms that should prompt medical attention, as delayed treatment increases the risk for complications and even death. High body temperature, altered mental state or behavior, change in sweating, flushed skin, nausea and vomiting, rapid breathing, racing heart rate, and headache. The clinic adds that delaying treatment can increase the risk of serious complications or even death, as they mentioned in the beginning of that little blurb. If you just simply notice that you don't feel as good while you're out enjoying the sun, or that you had enjoyed it and now you're taking a break but you feel off, it's good to make sure that you haven't been exposed to too much heat or be suffering from signs of heat exhaustion or heat stroke. And then to pursue appropriate medical attention if it's bad enough, but to make sure you're staying well hydrated and get out of the sun if you've already had too much. All right. And finally, the Journal of Back and Musculoskeletal Rehab, April 2021, looked at asymmetrical trunk range of motion associated with low back pain. So not having the same amount or degree of movement in each direction. Active range of motion analysis of 34 women showed that those with chronic low back pain exhibited a greater degree of trunk rotation asymmetry while sitting and standing. Such abnormalities can affect other movement patterns, increasing the risk for injury in additional areas of the body. Improving trunk flexibility and strength are common treatment goals that manual practitioners like chiropractors can apply when treating low back pain. So certainly as part of the assessment when looking at someone's posture, structure, how level and balanced they are, as well as the amount and degree and symmetry of that range of motion, tells us that there may be some dysfunction in some of the parts. And when you go to use those parts, if they're not sitting and moving right, that conflict is what creates problems, quite often pain and or injury. So improving the symmetry through that movement and getting those parts to better participate is a good part of the solution of not only getting you pain-free, but back to activity without concern or complications. All right, that's your daily health update for Tuesday. Hope you enjoyed it. Have a wonderful day if you haven't already. And tomorrow we'll be back middle of the week with your next daily health update. We'll look forward to seeing and chatting with you then. Take care.